Thank you very much, everyone, for joining this session. Just to let you know that this session will be recorded. So today, once again, we are discussing one more topic related to NAC OSCE, and that is a scenario that is in context of scenario of elevated liver enzymes. So, as all of you know, that I am an IMG and I'm conducting these sessions in regard to the bootcamp, NAC OSCE bootcamp. I think we have gone multiple times through the previous slides that in the previous sessions that what is NAC OSCE and what the question stems look like and how do we make a differential diagnosis and what are the basic history points. So I won't be going through all that. I think by now you all know me as well. If there is anyone new in the session and who wants to have an introduction or who wants me to introduce myself, you can just let me know, and then I'll go ahead with these slides. But I think we have discussed them multiple times in my previous classes, so I won't be going through them again today in order to save time. So today we will be discussing a scenario in the context of elevated liver enzymes when it comes to a NAC OSCE station. So would any one of you like to volunteer for today's session? Because I think now a lot of us know a little bit about NAC OSCE, that how it is. So if any one of you would like to volunteer, that would be great. You can unmute yourself and let me know.
Is that going to be a history-taking session, a history-taking scenario?
It will be a history-taking scenario followed by some counseling.
Okay.
Context
okay,
of
I can.
You will go ahead. Thank you so much again. So, okay, so I will be sharing the scenario with you that I would like to discuss today. If you need any help at any point, you can just let me know if you are, confused about any template or how to proceed. Okay, so this is your practice scenario that 39-year-old Sarah Williams comes to your clinic to follow up on her labs results. Talk to her in the next 8 minutes. And these are the lab results that she has. So you can take 2 minutes. It's 12:36. If you want to make your template or write differential, whatever, I'll give you 2 minutes for that. And meanwhile, all the other participants for your own practice, you can also do that if you want. So for those of you who have recently joined, we are doing this scenario. These are the lab results, and there is one volunteer who's preparing the template. For you, I will just go back for one slide. This is the scenario that 39-year-old Sarah Williams comes to your clinic to follow up on her lab results and talk to her in the next 8 minutes. And these are the lab results that I've shared. So one of the participants, and the 2 minutes are over. So are we good to go ahead and again? Or do you...
Yes, just a few seconds, sorry.
No worries. Take your time. I'm not doing it in timed mode for the same reason, because in the initial phases, you just need to, practice your content, and then later on you can practice your time.
Okay.
So take your time. Whenever you're ready, just let me know.
Mm,
Meanwhile, any other participants, if they have anything that you would like to share or write in the chat box, feel free to do that. Any questions that you want me to address at the end?
Okay, I think I'm ready.
Okay, so go ahead.
Okay, knock knock. I come in the room. I sanitize my hands. I'm Dr. Rahmani. I'm the doctor on duty today. May I confirm your name and address, name and age, please?
Yeah, doctor, my name is Sarah, and I am 39 years old.
Okay, Sarah. So I understand that you're here with the results of your blood tests. Can you tell me more about that?
Yeah, I just received a call from your office because I got some lab work done, and they wanted me to come and see you. That's why I'm here.
Okay. So do you mind if I ask you a few questions since it's the first time that I see you?
Yes,
A few
sure.
questions about the reason why you took this blood test, and yeah, can you tell me actually what brought you here in the first place before doing this test?
Yeah, so doctor, for like my general physical was long due for a very long time, and I was not just being able to manage time because of my hectic routine. So just these were a few days off, and it was the end of the year, so I thought that I should take advantage of my insurance policy and everything. So I just went through. I just came for the normal physical examination, and in that regard, in that context, I did all these blood tests.
Okay, so you didn't have any symptoms, any complaints?
Uh, well, all those things they're going on here and there in our lives, and with age everything comes and goes, but nothing I would say that nothing in particular that I can recall. Is there anything else, anything in specific that you want to know about?
Well, yeah, I will ask you a few questions, a few particular symptoms. Um, I also, just before getting to that, did the doctor who ordered the blood tests mention anything, like why she ordered these lab tests?
Yeah, well, she told me that she's ordering all these lab tests because I had gained a lot of weight as compared to my previous visits, and there were a lot of other things. She thought that I should be more up to date on my well-being because it was a while that I missed all my physicals. I had gained a lot of weight as compared to
Hmm.
my previous physicals, so she said it's better that we go
Okay.
through all the tests and do everything.
Okay, I see. Can you tell me more about the weight gain? How much weight did you gain, and for how, like, during which, how long?
Because my last physical was 2 years back, so I feel in the past 2 years, I was a size small, and then I turned to a size medium, and now I sometimes feel more comfortable in a large size of my clothes. So I don't know what's going on there, but I think it's just because I'm a big foodie. I love to eat, nothing else.
Hmm.
Yeah. So
Hmm.
I think the doctor is just getting worried more than usual.
Hmm. Okay, thank you. And do you know how much did you gain?
I
How
didn't
much
check
weight?
on the scale, but it's just from the size of my clothes that I can
Okay,
tell that, yeah, I have gained weight.
okay, perfect. So I'm going to ask you about a few particular symptoms. Have you noticed any yellow discoloration of your skin or your eyes
No,
recently?
no,
Okay. Have you had any itching in your skin?
no.
Any pain in your belly?
Yeah, sometimes I have this vague pain, but I think it's once in a while and I'm not really bothered.
Can you tell me where you feel the pain?
Yeah, usually on the right side of my tummy, sometimes I do feel some vague pain.
Hmm. And is that pain associated with anything? Does it come with food or any other thing?
No, nothing that I can think of.
Okay. And do you have any nausea or vomiting with the
No,
pain
no.
or mhm. uh, Any change? Have you noticed any change in the color of your urine or the color of your stool?
No.
Okay. Okay. So have you mentioned that you gained weight? Have you had any other symptoms like fatigue, excessive tiredness?
Yeah, I do feel tired all the time. I think it's partly because of my weight gain, probably, yeah, but I do feel tired. Yeah.
Okay. So I'm going to ask you a few questions about your past medical history.
Mhm.
Have you ever been diagnosed with any disease?
Like what?
Any disease, hypertension, like high blood pressure, diabetes?
Um, I'm not aware of hypertension or diabetes, doctor. I don't know because on my last visit I had one high blood pressure reading, but the doctor thought that maybe it's the white coat hypertension. I
Mm-hmm.
still need to book a follow-up for that. Yeah, but
Okay.
I'm not aware. Yeah, I'm still waiting on my results for my
Okay.
diabetes. Yeah.
Okay. Good to know. Thank you. Have you ever been? Have you ever received blood transfusions?
No.
Okay. Any surgery in the past?
No.
Okay. And do you have allergies to any medications?
No.
Okay. I'm going to ask you a few questions about your social history. These are a few questions that we ask of all patients. Um, may I know who you live with?
I live with my spouse.
Okay. And how do you support yourself financially?
Well, I work at a restaurant,
Mm-hmm.
at a fast food chain, and yeah, I live paycheck to paycheck, but yeah, it's manageable.
Mm-hmm. Okay. Uh, and is everything okay with the relationship?
Yeah, it's pretty fine. Yeah.
Okay, good. And I'm going to ask you about your sexual history. Are you're sexually active?
Yes.
Okay. And do you practice safe sex? And by that, I mean using condoms every time you have sex.
Yeah.
Okay. Do you use any other contraceptive methods?
No.
Okay. No pills or any other thing?
No, just the condoms. Yeah.
Okay. Um, okay. And do you drink alcohol?
Just occasionally, once in a while, maybe when it's holiday or something. I'm not a big drinker.
Okay. Holidays and okay. And how
Yeah.
often would that? Okay. 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 And do you smoke?
No.
Okay. And do you take any recreational drugs, or have you taken any recreational drugs in the past?
No.
Okay. Um, okay. Just one more question I forgot to ask you. Have you noticed any changes in your bowel habits? Constipation,
Uh,
diarrhea?
No, nothing that I just feel bloated sometimes.
Mm-hmm.
But I won't say like my bowel habit has always been very sometimes I do feel that I might have something related to it, but my bowel habit is just like that since my teenage. So
Mm-hmm.
yeah, but I do
Mm-hmm.
feel bloated, more bloated than before now.
Okay.
Yeah.
And for how long have you felt this bloating?
These past 2 years, since I've started gaining weight.
Okay, okay.
Hmm.
Um, and another question. When was your last menstrual period?
My period has been very irregular, doctor. I don't remember. Like sometimes I just miss 3 months, 4 months. It's very irregular. I can't
Mhm.
recall when it was.
Okay, this
I'm not sure.
irregular. And do you have pain with your periods?
No,
Okay. Um, um, and another question. Have you noticed any vaginal discharge or bleeding
no,
outside of your periods?
no.
Okay. Um, sorry, I'm just
Yeah, that's very nice.
even
I think you've
Um,
covered almost
okay.
everything. Yeah.
Just one more question.
Sure.
Have you noticed any changes in your skin?
Yeah, I do feel, you know, that like some of my colleagues, they were just mentioning, we went for swimming together, and they said that they didn't notice it earlier, but they felt that I have developed this black, you know, some rough skin and black skin at the back of my neck. So I have booked a visit to spa. Maybe I need a good, you know, facial and some massage to take that off, but there is some rough and black
Okay.
skin developing at the back of my neck. I think I
Yeah.
should see a dermatologist. Maybe I did not use sunblock during my swimming
Mhm.
activity. I don't know what's going
Okay.
on.
Okay, I will talk about that with you as well. And no acne, no increase in acne recently.
I have always have acne. Even in my teenage, I always had it.
Mhm.
Yeah.
And coarse and dark hair
Yeah,
in
I
your
do feel
chin.
now that I'm developing a few, you know, dark hair under my chin, but I think that's part of aging. Everybody gets it when they age.
Mhm.
Mm.
Okay, thank you for your answers. Uh, so based on what I see on your lab results, you have some elevation in your liver enzymes, and
Okay.
this can have a lot of reasons. But considering your history of weight gain, a little bit of fatigue, and your periods that are irregular, this could be something called non-alcoholic fatty liver disease. It is very strongly related to obesity or weight gain. And so there is inflammation in the liver, and it causes the liver enzymes to be higher than normal. And there are some other things that I would like to check. For example, your blood sugar, because there is also this is also associated related to an elevation in the blood sugar. So that is something to check for, because it's really important to detect if you have high blood sugar. Um, and Yeah, and I'm also going to check a few other lab tests. So right now, and also some other lab tests to check for other causes of liver enzyme elevation. But what I suspect most is this fatty liver disease. Um, yeah, are you following so far?
Yes, doctor. Yeah.
Okay. Do you have any questions? Have you ever heard about that?
No, doctor, this is the first time that I'm hearing about it. So, is it like hepatitis? I know only one disease with liver, which is hepatitis. So, is it something like that?
No, it's different, because hepatitis is well, we would also check for hepatitis we would also check that and try to rule it out. But this is also like inflammation in the liver. But it's a different it's a different disease. But in the long term, it can be bad for your liver. It can damage your liver in the long term. That's why it's important to take measures now to check your blood sugar. Your blood pressure that you mentioned was elevated once. We have to follow up for that. And if needed, we
Mhm.
can give you blood pressure medications. And one thing that's very important is for you to take some measures to reduce your weight, because this is the most important treatment, or the most important treatment to lose weight. Um,
So, how can I lose weight, doctor?
so I can we can talk about some changes in your diet and your levels of activity. So how much physical activity do you have in a week, let's say?
I walk to the bus station from my house, and then I take the bus, and then at my work, I'm standing for the whole day because I work in a fast food chain. Yeah, so that's it. It's from my house to the bus stop. It's like a 10 minutes walk every day.
Hmm.
Yeah.
And you go to work every day?
Except for weekends.
Okay. Okay, so it's recommended to have more physical activity, especially if you want to lose weight. And I can definitely refer you to a nutritionist for your diet, but also we can work around your exercise schedule. And yeah, that will be the first step to try to control to try to lower your weight by exercise and diet. And then we will see if we need to do other things to treat this fatty liver disease.
Okay, okay. That sounds good, doctor. Anything else that you would like to do? Any other tests that you would like to do for me? Or do you think that that's enough?
I would also, along with the lab tests, I would also like to order an ultrasound of your abdomen,
Okay.
again to check if there is anything else causing this elevation in the liver enzymes. But yeah, that's just to exclude other diseases.
Okay. Okay. Thank you, doctor. Anything else that you would like to add in again?
I don't think so, no.
Okay, thank you. So, Nagin, that was very well done. And there are just a few things here and there that I would like to, polish. And other than that, you did a very good job. So, first of all, let's go back to the scenario. And when you saw that, sorry, I have to go back. Yeah. So when you saw that she's 39 years old and she is there to follow up on her labs, what did you write on your notebook? That in your 2 minutes, what were the things that you wrote on your notebook?
I mean, I just wrote history of present illness. Well, yeah. Well, the thing is, I have not yet practiced for these scenarios. So far, I've only been practicing for when a patient comes with a chief complaint.
Yeah,
So maybe I don't
that's
have the right
fine.
structure, but
That's totally fine. Yeah, I know
Mhm.
because it's just the beginning stage of NAC OSCE, so that's perfectly fine. Just whatever you wrote. It's not in like
So,
regard to this scenario. Like whenever you see a scenario, what do you write on your template?
so first I write the history of present illness, asking about chief complaint. Here, there's no chief complaint, so I asked. So I wanted to ask why this lab test
Okay.
was done, and then any
Yes.
symptoms, and then ask the symptoms one by one.
Okay.
And so that's the history of present illness, and then the rest has medical surgical history. Yeah.
And your list of differential diagnosis by looking at the
Uh,
labs?
Based on the labs or based on the
Yeah.
history or everything.
Yeah. Okay. So just a tip from my side that whenever you see the template outside the room, for example, this is a template and it is followed by lab results. The moment you see that it's a female, on the corner of your page, just quickly write MGOS. MGOS stands for the menstrual history, obstetrical history, gynecological history, and the sexual history. So that you don't forget because you recalled asking me for my LMP, but in the end of the
Yes.
discussion.
Yeah.
So whenever you see, this is one tip from my side, that whenever you see outside that, for example, if it was a child here or a teenager, just quickly write Bindi if it's a child, or heads history like you do for teenagers. Or for example, if it's an elderly, you quickly write that, I have to rule out abuse and stuff. So those points that you cannot miss, just quickly write them on top of your page. And other than that, when you're doing counseling, just quickly on the side of your page, because you know that you have to talk to her in the next 8 minutes. That means there is no physical examination, right? So just quickly write on the side that what kind of pattern will you follow. For example, I will show you in my slides later on. I use a mnemonic iBucks, but whatever mnemonic works for you, just write that quickly on the side so that when you're talking to the patient, you don't miss on any of the counseling points. Okay. Okay, now let's go to this. So by looking at this, as we know that ALT is more than AST in this scenario, and GGT is normal. So this is pointing, and the ratio between them is, less than 1. So this scenario points out more towards non-alcoholic fatty liver disease. Okay, so now the moment you see this and the template, you should be thinking that what can be, the causes of developing a fatty liver in a patient. So you will also write your metabolic causes, and those are your risk factors. So when you see such a thing, because you have to do counseling here, so quickly write on the side that what is important in her past medical history and what is important from the point of view of her risk factors, because it is not alcoholic. Okay, if it's alcoholic or something, if they give you a different history, like unprotected intercourse and all those things, or tattoos, then it goes towards, the scenario goes towards other counseling stations or other set of questions. But right now it's non-alcoholic fatty liver disease. So you will quickly write on the side that what risk factors would be there that you would like to know specifically, and in past medical history, what are the specific things that you're looking for. Okay. Now, this is a a small template that I made, that you greeted the patient the way you did, and you introduced yourself, you sanitized your hand, you asked the name, confirmed the name and age of the patient, and you started with an open-ended question that how can I help you, or what brings you in there. And whenever you asked all the W questions, which was the correct thing to do, because whenever there is an event, for example, if it's a history of a fall, or there is a lab result, anything that is like that, so you always start with these questions, that you ask that why was it done, when was it done, what were the results, so as many questions, you have to tailor it according to your patient, and you did the right thing by asking those questions. You were focused and your questions were very nice. Now, you asked me about the presenting complaints as well, fatigue, right upper quadrant discomfort, and all those things. So you did very well in this section. Now, when we went for the symptoms review, usually when you see a GI station, there is a cluster of symptoms of GI. For example, upper GI, lower GI, then there are liver symptoms. So you have to, if you find one symptom in the presenting complaint, you have to dig out on the other symptoms. So now, for the general symptoms, you asked me if I was tired, fatigued, and abdominal discomfort, and I answered you all those questions. Now, there are some liver-related symptoms that you asked, which was very good. Then associated conditions like weight gain and all that, you asked me that. Now, you asked me about diabetes, high cholesterol, recent tests. So, you covered all those things. Now, coming to the risk factors, one thing that you should have, like you said, diabetes and hypertension, but if you're considering non-alcoholic fatty liver disease, you should be thinking about PCOS and thyroid disorders and all those things. So the moment I gave you the history, when you asked me about my LMP, and I said that my period has been irregular, so rather than going into the gynecological history, because that will just waste your time, you don't have 4 more minutes, because you have to do counseling as well. You should quickly ask the patient, okay, so you have an irregular bleeding and you did not have your periods for 3 months. By any chance, are you pregnant? And the patient will say, no, I'm not. This is the way my periods are. So you can just ask her, so did you ever get a medical advice for that? And she will quickly tell you that, oh yeah, I was diagnosed with polycystic ovaries, 2 years or 3 years back. So right there and then you get one of your diagnosis. If you will ask her about other gynecological history at this station, I feel it is not very relevant, like the vaginal discharge and all those things, because they will just, waste your time on this station. So the moment you see that, and she mentioned that I have gained some weight and, it's alcoholic fatty liver disease, so you can quickly touch on a few signs and symptoms of, fatty liver, for example, and the metabolic disorders that come with it. So just a few things here and there, just to for you to reach your goal very quickly, rather than asking a few more questions of gynecological history. You did very very nicely, but just ask the patient that, okay, you have an irregular period, have you ever sought any medical advice for that? And she will tell you that, and if she says no, I have never gotten any medical advice, then the way you did that, what were your symptoms and everything, okay? And you asked me about the social history, and like you covered all these points very nicely. Now, this is the mnemonic that I use usually for counseling stations, which is IBUX. You give information, you take a brief history that you already did, then you develop that understanding that does the patient know what it is about, and you explore the concerns, and then you explain, and then you summarize. So this is a few counseling tips that I've written here, that based on your history and the results of your test, you have a condition, you explained everything very nicely. Then you reassure the patient this is a common condition, and almost a lot of people can have this, and that is the reason that you are gaining this weight and all those things. And then you invite questions that so we want to work together on your weight loss, and I would like to set a different appointment with you to discuss weight loss measures. Whenever you're ready for that, we can set up a follow-up appointment, because right now at this station she's there to discuss her labs, and you can just tell her that right now with your fatty liver disease, our target is that you lose about 7 to 10% of your body weight. It can significantly improve your health. That means losing almost half a kg every week. We can target that, and then slowly and gradually we can increase the target. And then I recommend a balanced diet like Mediterranean diet. And over here you can just tell the patient that I can refer you to a dietitian. We have some very good dietitians on board, and I can refer you to one, and they can guide you that what kind of diet you should be taking. And then exercise also, because you should tell her that according to the Canadian guidelines we need to do 150 minutes of exercise every week. So this will, make it a little bit more crisp. Other than that, you will address her comorbidities that based on your history, as we mentioned earlier, things that you can have diabetes, you can have high blood pressure. So these are all the things which are associated with your non-alcoholic fatty liver disease. And you're already mentioning that you have developed this black, rough skin at the back of your skin. So this
Forgot
happens.
to talk about that.
Yeah,
I
that's fine.
wanted to talk about that too, but yeah.
Yeah, that's fine. That's why I say just quickly write whatever, if there is anything that the patient tells you and you feel that you have content on that and you can discuss that, just quickly write that on your page. Okay, so that you don't miss it. And then you set up a follow-up plan that, okay, so based on your all these things, there are certain things that we need to do. And in the beginning of, like, when I usually do the counseling for such stations, I also discuss the lab results with the patient. So I will take the lab results and I'll tell the patient that, okay, so these are your liver enzymes, and the condition that you have right now, the fatty liver disease, in that condition, ALT usually rises. So some people can have this fatty liver without any changes in their liver function tests. So that is just the beginning. But once the changes start in the liver function test, that means that your liver, this is the normal range, but now your liver function is increasing, especially your ALT. That means that the liver is going towards some damage, and we need to control this damage before it gets out of hand. Therefore, we sometimes do some scannings and some follow-up investigations just to make sure that everything is going fine. So I would like to do an ultrasound abdomen, preferably with SWE, just to see that if there is any cirrhosis. And I would also like to refer you to a hepatologist for your regular checkups. So usually after the first ultrasound, if everything is okay, I will see you in a year. But if we find any changes in the liver, I would like to see you in 6 months, or I can just refer you to the hepatologist for further investigations. So whatever thing works for you. So this is like you're giving the patient a plan to do the things. And usually when I do counselings, what I do is I include risk factors inside the counseling part, not in the history part. So once I'm done with taking the first history, when I come to the risk factors, I will ask the patient, so as we have discussed so far, the condition that you have, there are various risk factors which are responsible for that. So have you ever been diagnosed with high blood sugars? Have you ever been diagnosed with polycystic ovaries? Have you ever had any irregular periods? Stuff like that. And one thing more, that when you start your station and you have some lab results or an event or something, so you always ask the patient that, would you like me to discuss the lab results first, or is it okay if I go ahead and ask you some questions just to get a better idea of what you're going through? So like this, the patient, it can go either way. The patient might tell you that, oh no, I need to know the results first. So then you go and discuss the results first. So these are a few things here and there. Other than that, you did very well in all those points. And now I have added this one more slide, that there can be a post-encounter probe as well, because it's an 8-minute station. So once you are done with all the counseling history, because there is no physical exam, right? So you have to do history and counseling. So after that, there can be a 3 minutes of post-encounter. Questions can be asked? What is the most likely diagnosis? And you already mentioned that. What investigations would you recommend for this patient? So you can say routine investigations like CBC, lipid profile, fasting blood glucose, thyroid profile, liver function test, or you can just tell the examiner that since the patient just mentioned that she had her physical recently and she's waiting on her results for her diabetes, so I will not be repeating the test for HbA1c and fasting blood sugar, but I would like to go for other tests like her lipid profile and her, CBC and maybe a urine complete. So all the tests which are missing, and I would like to refer her for an ultrasound to see any liver steatosis. and to have an assessment of her fibrosis, the stage of her fibrosis. So this will give a compact answer to the examiner, and the examiner will have the idea that, okay, you were listening to the patient, because the patient already mentioned that she just had her physical and she had some tests done and she's waiting for her test on diabetes. So, you don't have to do those tests again. But if you will give giving just this answer will also get you points. But if you will, point this thing out that you were listening to the patient, then it will give you some extra edge, as compared to others, that she was listening, the doctor was listening to the patient and she was paying attention. Now, how would you manage this patient? So because it was not a physical examination station, whenever it's not a physical examination station, you always start mentioning the physical exam. Okay, that's a tip from my side. So you will say that I will perform a physical exam and counsel the patient on lifestyle modifications like weight loss, diet, and exercise. I would like to treat her comorbidities. I would like to see that how her blood sugar results are, and if she needs a referral to an endocrinologist, I will arrange for that. You can also add that I will give her some educational material on, the topic, and I would like her to have the patient information, and I will set up a regular follow-up for monitoring of her sign and symptoms. So all these things, the referrals, the brochures, the information things, it will come in the management, okay? And they might also just ask you in post encounter that, can you summarize this station, that what you did for the patient? So you can just say that this patient most likely has non-alcoholic fatty liver disease. Based on the presence of obesity, diabetes, mildly elevated liver enzymes, I would recommend lifestyle interventions first, which include weight loss and a Mediterranean diet. And additionally, I'd monitor her liver function tests and consider further imaging, including ultrasound abdomen with SWE, along with referring her to a hepatologist. So this is how you will briefly summarize. One thing more that I would like to tell you is that when you end up the station, when you are done with all questions, answers, everything, you have to give a good wrap up to the station. Okay. So you thank the patient, you tell the patient, okay, thank you very much for answering my questions. If there are any other further concerns, I would like to listen to them. But if the patient says, no, I'm fine, so just tell her, thank you very much for answering my questions. And I will be running some tests and doing a physical examination to see further what's going on. So you just tell the patient in the wrap up as well that I will be doing a physical examination and I will be doing some tests. Okay, so till now, till this post encounter probe, everybody can answer all these things. Okay, can you think of anything else that will give you some extra brownie points? Any one of you in the chat? Considering this entire scenario, is there anything else that comes to your mind that is out of the box, that a lot of other students will miss?
In counseling or in history taking?
Anywhere in counseling or in her management, anything you can say, or any investigation, anything that comes to your mind that you feel that you can do differently from other candidates. Maybe 10% or 50% of other candidates will do that. But that will give a very good impression to the examiner about you. Yes, please, Sarah, go ahead. Sarah, I cannot hear you. Sarah, I cannot hear you. I can see your hand is raised, but I cannot hear you. If you can type it in the chat box if your mic is not working.
Can you hear me now, Dr. Sinha?
Yeah, I can hear you.
Okay, so when she mentioned that she has irregular menses and she is having PCOS, we can always ask if she had been pregnant before, and maybe she come up with infertility issues, and we can, go to that direction also, and we can always work up for the primary infertility also.
Exactly. Very nice. Very nice. That was something that I wanted to bring your attention to. So if you need some brownie points in the investigations, you can always say that she's a 39-year-old female and she has a history of irregular periods. So I would first like to do a pregnancy test for this patient. So, this is something that will give the examiner this impression that you are looking at the patient as a whole. You are not just looking at her immediate issue. So these are few things, that give you an edge. So as Sarah mentioned, it can just turn into an infertility station. The moment you go in and you ask the patient her questions and you find out that, oh, she's there for something else. Maybe it turns out to be a depression station, because if, the way, and again ask that, how is everything with your spouse and everything. So it can go either way. Because this is the beginning of the NAC OSCE, so I'm not bringing those things in, which have some twists and turns. So in the beginning, we need to, work hard towards developing our skills to take history and counseling. And then once we know our set of questions on our fingertips, then we can go ahead with that. Okay. So key check points for OSCE. Usually I use this mnemonic ECPMP, which is empathy, clear communication, patient engagement, management plan, and professional demeanor. That means that you have to maintain. Sarah, sorry, your hand is raised. Is there anything that you want to say? Sahar, yes, Sahar, please go ahead with the question.
Hello, can you hear me?
Yeah, I can hear you now.
So sorry, it's my headphone bugging me. So I'm asking, whenever the patient comes and we are asking for past medical, in every patient we have to rule out abuse, and in every patient we have to ask the MOPS, the mood and OCD and anxieties. We have to take psychiatry history in all, because it can be, a hidden agenda in that.
Well, it's just one question that you need to ask. Okay, you don't have to spend a lot of time on that.
Okay.
Because yeah, for example, if you're suspecting, for example, she's a female and you're suspecting, you have to rule out abuse. You just ask, how's everything? How's your relationship with your spouse? The way Nagin asked. If she says it's fine, just cross it and move forward. Because if you ask too many questions, you will be wasting your time on that station. So yes, you have to touch on abuse, child abuse or elderly abuse, or if it's a female, if it's a young child, you have to always rule out the bullying part. But just one question. Yeah, if you get the correct answer, just cross it and move ahead. But if you don't get a good answer, or you are looking from the body language of the patient that there is something going on, then you dig more into it. Yes, please, Nagin, go ahead.
And also, she mentions that she has fatigue. Is that enough to probe into symptoms of depression?
Like if she says she has fatigue, because fatigue itself is a very long topic. Okay, when it comes to when we will practice someday the history of fatigue station, fatigue has everything in the world in it, because everyone can, there can be so many factors for fatigue. So if you will dive into that side unknowingly, you will just end up drowning in the station. So when she mentioned that, yes, I have fatigue, so you can just ask her one question: is it manageable, or do you think you need help for that? So if she thinks that no, it's manageable, she will be like, yeah, it's manageable, doctor. So just cross it out and go ahead. But if she says, no, doctor, it's really messing up my life and my mood, so then grasp that point and ask her, okay, how is it affecting you? How is it impacting you? Then she might open up more, and then ask her quickly MCQ caps, that how's your mood, how is your interest and everything. But if she doesn't give you a clue on that, just move on. But you do have to ask her. Okay, you cannot just put it under the carpet. You have to ask her that, okay, if she said, yeah, I'm fatigued, ask her, okay, can you is it manageable for you? Do you need help with that fatigue, to manage your fatigue? She might say, no, it's manageable, doctor, it's nothing that I need help for, and just go on, go towards your goal. So yes, hidden agendas can be there, but there are, like, not every station is a hidden agenda. You might get 2 stations, maximum 3, and the hidden agenda is something that if you stick to the template of your questions, you will get there. But if you don't, if you forget, if you follow your pattern, no matter whatever the patient is telling you, if you're lost somewhere, just grab one symptom that she gives you and start from there. If she says, I have pain, just start OPQRST and everything, and it will take you somewhere. But don't just, haphazardly ask questions from here and there and all over the place. Any other questions that we have? Okay, so this is the checklist for the examiner's checklist. Next, yeah, this is just a point to remember, that always remember that if AST to ALT ratio is less than 1, we all know it's non-alcoholic fatty liver disease. If it is approximately equal to 1, it is most probably, aspirin induced or drug induced, acetaminophen induced, or maybe an acute viral can also give you some the same picture. And if it is the ratio is 2:1, more than 2, we all know that it is always alcoholic hepatitis. So that was pretty much from my side. These are the bootcamp details. My session is starting from next Saturday, January 10th, and the timings are 11 to 2 Calgary time. It will be Saturday and Sunday, 2 days a week. And these timings are for the weekday classes. I'm not starting a batch on the weekday currently. It will be weekend classes so far. And the timings are 11 to 2, and course fee is 400 Canadian dollars, and I plan to cover 140 to 160 high yield cases. Number of students in each batch will not be more than 12, and these are the units that I'll be covering, 16 classes, and you can see the breakdown. And this is a brief, I keep on repeating it in every presentation, but these are the topics that I'll be covering in each section. So that's it. Any questions and clarifications so far? You can let me know, and you can join my Telegram channel at medicinebyheart@gmail. I can post the link here in the chat also for the chat group on Telegram. And if there is anything else, let me know. If there is any question, you can reach me out at medicinebyheart@gmail.com. Anything else that you guys need to ask me for today?
Sorry, regarding the consultation stations,
Yeah.
you said that we can also ask them if it's okay, like it's an option to just talk about lab tests and before taking the history, but I think it makes it very hard and it may get stuck because like we don't have a good differential diagnosis. So like I'm a bit hesitant to ask that question.
But if usually if you ask that question to the patient, that gives a very good impression. So if you and usually the patient, they will just say that you can go with your time, because when I did it in my exam, I did the same. I said that I would like to discuss these labs with you, but is it okay if I ask you some questions just to have a better idea that what's going on in there? And the patient was like, yeah, please go ahead. So you just ask that one question. The patient will not say that no, I just want to discuss it first. Usually they will give you that edge, that whatever you're comfortable with. And if you are asking too many questions and you are going away from the agenda, usually they also ask you to come back. Like they will just prompt you, and they will tell you that can we discuss the labs now, because they know that you are running out of time.
Okay.
Yeah, so you should follow your set of things. You should always ask this question. It will give a very good impression that you want the patient to be comfortable with you. Yeah. Anything else? Any other questions? No, I think then that's it. Thank you very much, everyone who